According to the FBI, in recent weeks, cyber actors have engaged in phishing campaigns against first responders, launched denial-of-service attacks against government agencies, deployed ransomware at medical facilities, and created fake COVID-19 websites that quietly download malware to victim devices. And it doesn't appear to be letting up anytime soon. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, senior writer with AHA. In this second part of a two-part podcast, two senior officials with the Department of Homeland Security are speaking with John Riggi, AHA's senior advisor for cybersecurity and risk, about what is being done to protect the healthcare sector in the midst of a national public emergency. The voices you'll hear are DHS Undersecretary and Chief Intelligence Officer David Glawe and DHS Assistant Director for Cybersecurity and Infrastructure Security, Bryan Ware. We'll pick up the discussion with John.
So at the AHA and throughout our nation's hospitals, we remain very concerned about the protection and privacy of patient data, but we prioritize any cyber threat which could interrupt patient care delivery and or compromise patient safety, such as a ransomware attack or medical device vulnerabilities. Could you tell us from the DHS perspective, what is the biggest concern? What is your biggest concern or a threat regarding hospitals, especially in the midst of this national public emergency? Dave?
Yeah, John, thanks. And I'm going to touch on a couple issues with that. I'll talk about cyber, but I would be remiss if I don't talk about the terrorism threat as well that we're seeing on the homeland regarding to COVID-19. And while we have an opportunity to talk to your listeners, I think it's relevant to the American Hospital Association to hear about that as well. And I see the threats, the classified threat picture every day with regard just to the threat to your industry, but all industries across the United States. I receive the same briefing the president gets. And my greatest concern right now for the industry, the healthcare industry, is you are in the front lines protecting us, protecting my family, and you are that front line on this war, and keeping you safe is critical. But an attack to your Internet of Things or your infrastructure, your cyber, your technical infrastructure that could disrupt critical patient care or your employees' capability to give that care is one of my biggest concerns. Is there adversaries from criminal actors or foreign adversaries or terrorist actors? Are they trying to identify and look for vulnerabilities in the healthcare industry because you're providing that critical service to those patients out there? And the answer is yes, they are. I'm seeing that. I'm seeing our adversaries, terrorists, criminals, and nation states looking at the COVID-19 and the vulnerabilities we have across the United States. What's that caused? And that's my concern is there a vulnerability in the cyber infrastructure that could be attacked and disrupt services of critical care of whatever your medical devices are connected or how you communicate? That's one of my biggest concerns. My other one right now is we're seeing right now terrorist organizations and violent extremists looking at COVID-19 and the response to it, specifically the health industry. That's where people are gathering. That's where the care is occurring. That is a vulnerability. How do we get that information out to you as we're seeing that? And how are we look into our resources to give that force protection around your facilities as well as protecting the cyber infrastructure? So we're looking at it from twofold. And the challenge we always have in these big events, national security infrastructure events, is our adversaries are looking for our gaps in our armor, our gaps in our protection, and how they can drive through those to cause us harm. And my job, along with Assistant Secretary Ware and Director Krebs, the Director of CISA, is to help bring the department's resources to bear to get that information out to you. And then CISA is to help you with some of those prevention mechanisms that he talked about earlier.
So glad to see you're focused on all threats to the healthcare sector, not just cyber, and the interconnection between those potential threats, something that we have not focused on, and hopefully will not, as terms of a terrorism threat. Dave, just a quick follow-up on that, on terms of the potential cyber threat related to terrorism. Do you see that more on a domestic side or an international side related to terrorism?
Well, we're seeing it both. Specifically, some of our domestic terrorism organizations, our violent extremist organizations, the Homeland, and I'm pivoting, sorry, John, I'm going to answer the first part with the terrorism side, is looking at a couple different vectors. Weaponizing COVID-19 as a potential attack vector, which would be difficult, but it's clearly could be used as a biological attack vector if it could be weaponized and delivered. The second aspect is looking as a gathering place for providing critical services to the public is a vulnerability that the terrorist organizations, domestic and international, have identified worldwide. And from a cyber, we already know that our criminal cyber actors and our terrorists and our foreign, our nation state ones, know where our vulnerabilities are and know where our critical infrastructure is. And the countermeasures we need to put in place is what Assistant Secretary Ware does in CISA in partnership with the FBI to harden your armor on that. But we're looking at multiple different threat vectors right now in vulnerabilities, not just the healthcare industry, but all of the critical infrastructure and the public right now, specifically related to the COVID-19 and the continuously evolving threat that causes by those functional threat vectors that I talked about, terrorism, nation states, and criminal actors.
Thank you, Dave. So with all of this intelligence that you're gathering and the intelligence capability that you have, how does the Office of Intelligence and Analysis help inform your assessment in national cyber policy?
Yeah, John. So we are the hub for the Department of Homeland Security to create a strategic picture of the threat to the homeland in partnership with all 17 U.S. intelligence community organizations. And I mentioned the big ones you're familiar with, and I'm sure your members are familiar with, is the NSA, the CIA, the FBI, and ours. But there's also the other ones that are also involved from the Department of Defense specifically, that they bring their expertise and their intelligence. And we collaborate and we provide a cohesive threat picture based on any threat, and specifically to yours as well. But with that, we have collection requirements to go out to those organizations so they can collect the information on where our vulnerabilities at. We have standardized processes, how we bring it together, and then how we disseminate that at the lowest classification level so it's relevant and timely to our partners, which is the state, local, and private sector, is what my statutory mandate is to share that information with you. And I'd be one last thing I'd say is, how do you get this information? Is Homeland Security Information Network.gov, HISN.gov, and your members can sign up for it. It goes through a quick clearance process, and they will have access to the intelligence information that we publish online in partnership with all those organizations. With HISN.gov, and John, I know we shared that with you before, but we'll share it again, and we can disseminate it to your membership and how they can sign up for an account.
Great. I appreciate that forward-leaning stance there to share information. That's hsin.gov. Bryan, turning to you, there's an oft-used phrase when it comes to cyber breaches, right? It's not a matter of if, but when. What resources does DHS have to help hospitals not only prevent attacks, but also prepare for that eventuality?
That's a great question. So we have, on the CISA.gov website, there is just a tremendous amount of materials for everything from planning to training resources, ways to assess risks. We have documents we call our Cyber Essentials. And really the idea behind the Cyber Essentials is that if you can employ those essentials, you're going to remove many of the risks that we see. We know that the healthcare sector broadly is the victim of about 50% of all ransomware attacks. So all the ransomware attacks between 2017 and 2019, about half of those were targeted at the healthcare sector. The idea behind the essentials, things like multi-factor authentication, things like having backups, those essentials will give you the greatest degree of protection against ransomware and other situations that may arise. Ransomware is, you've been kind of asking Dave about some of the threats that we're seeing now and some of the things that we're the most concerned about. Ransomware concerns me greatly right now because one of the reasons that hospitals and others are targeted by criminal actors is because the life and death mission that they perform, the incredibly timely mission that they perform, from the bad guy's perspective, gives them the highest chances of receiving a payout. This is something that we're concerned about because of that attractiveness for them. But in this period of time where our healthcare system is already being stretched, and it is already, we're so reliant on it. We can't absorb. We don't want to see ransomware attacks here in the U.S. And so prevention is an absolute key. I would also just say to all of your listeners, the bad guys are smart, right? They see all of the media attention that COVID is getting. It's the only thing that we all talk about all day long, and they're targeting emails with that COVID messaging to lure you in a moment where you're rushed, or in a moment of curiosity but not being careful, to click on these phishing emails and inadvertently download malware that's going to allow them to accomplish their objectives. And so across all of your listeners and across all of the the hospitals and the healthcare system more broadly, we have to just be all that much more attuned to our adversaries' attempts to capitalize on this situation that we're in, and be very careful with our email habits so that we don't fall victim to those. But again, we offer, in addition to just these, the guidance and the training, we can provide anti-phishing training, which we have. So it's kind of live services that we provide. I mentioned before the scanning of any internet-connected devices. That is a free service that we're providing. And in some cases, we're also offering web application scanning. So particularly in areas where we're seeing significant national need for a web service, then we've been scanning those as well to identify potential vulnerabilities that a bad actor would try to take advantage of. And so you can get to us through that CISA.gov or through the US CERT website to request additional active support from us.
Thanks, Bryan. And what we'll do is we'll make a list of those services available with the publication of this podcast. So that's very helpful. Dave, does DHS conduct risk assessments? Is it possible to prioritize hospitals at this time?
I'd probably turn that back over to Bryan, specifically about going out and conducting risk assessments and what I would call the red teaming. What we do, John, and I know you and I have worked on this in our past capacities at the Bureau, but we do take the threats and the vulnerabilities to industry's private sector. And we work with a team of national security experts that look at vulnerability. So my team, my Cyber Mission Center, partners with the CIA, the NSA, and the Bureau, and we look at vulnerabilities to certain industries or certain critical infrastructure, and we work out realistically the what if scenarios, the doomsday scenarios of what could our adversaries, criminal or foreign adversaries, do to affect it, and then what are those countermeasures. So John, we'll take that back and see if I have some classified products specifically for the healthcare industry. I'm sure there are, and to get that back to you, and I know you still have your clearances as well. But I'd ask Bryan maybe to illustrate what CISA does in this arena, because I know they do a lot of work in partnership with the private sector on the what-if scenarios and how to put countermeasures in place.
Yeah, thanks, Dave. We did, John. We did publish a guide for really targeted any kind of business with how to do risk management in the COVID-19 environment specifically. So that we just published that in the last couple of weeks. The cyber hygiene scanning that I mentioned before is really a way of us doing a vulnerability scan for an agency. We're an agency. We're the agency. We do it on behalf of industry and other government organizations. So if you had a company or a hospital that wanted to have that cyber hygiene service, and what we're going to tell them is which vulnerabilities we've discovered that they have, with a rating of those vulnerabilities so that they can prioritize the critical ones to try to address as urgently as they can. And then in cases where there are some significant concerns, we are coordinating with HHS and CDC and others to do remote vulnerability assessments or remote risk assessments, and those would certainly be available to hospitals within your membership.
Thank you, Bryan. So with all this information, let me say, here's my biggest concern, as we've been somewhat touching on throughout our conversation: a ransomware attack which shuts down patient care operations in a hospital filled with coronavirus patients. Worst case scenario, causing network-connected ventilators to become inoperable. Hospitals are often advised to contact the FBI if they suffer a ransomware attack, but their role is investigation and attribution. Would DHS components, such as CISA and or FEMA, be able to respond along with the FBI in such a situation? And how could they help a victim hospital recover? Bryan?
Yeah, so CISA, we've got all the guidance that we've been talking about before on ransomware and so forth. But you're hitting on something that we've been concerned about, for several weeks now. This is why we're expanding our monitoring. It's why we're coordinating on a constant basis with our military and our intelligence partners to see what adversarial activity they may be able to see in other countries, all with the goal of preventing the kind of incident or situation that you just described. But if something like that does take place, CISA is prepared to be an advisor to restoring those services. This is something that we do frequently. So if there was an attack, we're positioned to come in and to help both understand what took place, but also advise and assist the hospital in recovering from that. And particularly when there's a criminal actor, we're there with the FBI. They have a slightly different role in managing that incident than we do, obviously trying to find who that actor was, attribute who that actor was, and to shut them down. And in our case, we would be there to help to restore network functions, network operations. FEMA, yes, I think there are some scenarios in which FEMA could be called upon to provide additional resources, but they would likely do that through a request from CISA.
Bryan, thanks again for shedding some light on how that process works and your mutual concern of ransomware attacks on a hospital right now. Quite frankly, our position here at the American Hospital Association is that a ransomware attack on a hospital now or at any time crosses the line from an economic crime to a threat to life crime, and we really believe it should be pursued and prosecuted by the government as such. And Dave, and you know what I'm talking about when I say prosecuted in all sense of the government's capabilities. So as long as we're speaking about interagency cooperation to assist victim hospitals, there is a concern among hospitals that when they call one part of government, such as DHS and the FBI, for help, those agencies might contact the hospital's federal regulator, Health and Human Services Office of Civil Rights, or their state regulator, and attempt to identify some type of regulatory compliance shortcoming. So does DHS have any responsibility to notify or provide breach-related documentation to a hospital's regulatory agency? Bryan?
So, John, CISA does not have any responsibility or requirement to notify any entity's regulator. And in many cases, we are precluded by law from doing so. I mean, we are set up by design to partner with the commercial industry in the interest of making your hospitals more secure. We don't serve a regulatory function. Now, generally, CISA does not share the information that entities share voluntarily with us, with any regulators for any regulatory purposes. There are times when we want to pursue, as you were just kind of describing, we want to pursue that bad guy. We want to impose consequences. And so when we believe that there is information that should be shared in order to support our law enforcement partners, our intelligence partners, our defense partners, we do that in cooperation with the commercial entity. So we don't do that on our own. We do that only in cases where we have consent from the commercial entity.
Thanks, Bryan. It's very encouraging, and of course, we would encourage our member hospitals to reach out for the government, hopefully prior to an attack, but certainly should they become victim of an attack. Bryan, is there anything else you would like to share with our audience today?
I just wanted to say to your audience, we very much appreciate the really important work that you're doing, and we know that you're doing it under the most challenging and difficult circumstances. The last thing that I want to see happen is for your healthcare mission to be interrupted by cybersecurity risks. And we're doing everything that we can to prevent those from taking place. We are here to support you in any way that you need to, that you need us to. We don't want to inundate you with data or documents or briefings or any of those things, but we are producing them. They're on our website. If you request of us anything else, we're going to go out of our way to deliver to you what you need. We have stood up what we call our COVID CAT, our COVID action team inside of CISA. It's working across CISA and coordinating closely with FEMA and HHS and others to ensure that everything that we're seeing, that they're seeing in their response activities and vice versa. We're working closely and have been working closely with the Department of Health and Human Services to help us to know which parts of the healthcare industry they believe are the most critical or the most in need of additional cybersecurity awareness and so forth. So we've been at that for several weeks now, hopefully not in any way posing, additional work or this already stretched part of our response, but trying to be a supporting partner behind the scenes to reduce any cybersecurity risks that you may face. So that's probably the only thing that I want to emphasize, that we're here to support you. We want you to be able to do your mission of really the healthcare response to this unprecedented pandemic.
Thank you, Bryan. Just one quick follow-up. When our members need help, how do they get a hold of CISA?
You go straight to CISA.gov or uscert.gov, US as in United States, US-CERT.gov. There is an 800 number. There's an email. That is a 24/7 function. Will get you the response that you need.
Dave, we heard a lot about the regulatory concern and the role of DHS from Bryan. What is your perspective on the regulatory concern by our members?
John, thank you for that question. And I've dealt with this for quite a few years in multiple different roles, being the Deputy National Intelligence Manager for Threat Finance and working with Treasury's Office of Intelligence as well as the regulatory arm. I currently work, obviously, in Department of Homeland Security, where Coast Guard has a regulatory oversight in the marine environment. So, and as Assistant Secretary Ware said too, from an intelligence organization that I run, intelligence officers, our goal is to collect information to identify threats to the industry, national security threats to the industry, as well as threats to the homeland and how that could affect the public, critical care, as you mentioned earlier. And that is our role, and that is solely our role. We have no regulatory interaction whatsoever. The information we disseminate is to intelligence organizations and law enforcement only in the private sector. So that role is completely divorced from any of the regulatory sides, and it has to be that way in what we do. So I just wanted to make that very clear, because that's a concern a lot of time by the private sector. The regulatory side of it causes areas of concern, and there's been some times where the private sector doesn't want to share or is concerned about sharing information, especially through their general counsel's office, that if they share this information, it could show some sort of a potential civil vulnerability they have with the regulatory oversight. So I just want to be very clear. That is not our role whatsoever. This is an intelligence organization, to identify threats and to help you mitigate those threats.
Thank you, Dave, for that clarification and stressing the importance that your role, the department's role, and CISA's role is to help victims of cyber attacks. Appreciate that very much. So, Dave, Undersecretary Glawe, what final thoughts would you like to share with our audience today?
I just want to close, John, by thanking your members, thanking the association, and thanking everyone in the healthcare industry. You are the frontline defenders, the warriors that are on this fight. The sacrifices that they are making, you are making, your families are making to keep us healthy, to keep us safe in this new fight that we're in. And I just want to remind everyone how critically important that partnership is, that integration of private sector information, intelligence, as you're seeing the threats evolve, in our dynamic environment of sharing that information back to you tactically, so you can immediately identify those threats that are coming in, but strategically trying to inform the industry exactly where these threats we think they're going to evolve to over the next 6, 12, 18 months. We're in a new environment. We've got to change our posture aggressively to get out in front of these threats, to be proactive, to look for that anticipatory intelligence to get you that information before the threat is upon you. I just want to again close and thank you so much for the efforts. Thank you so much for the sacrifices that your members give us every day.
Thank you, Dave, and thank you, Bryan, for joining us today. And on behalf of the American Hospital Association and the nation's hospitals, we'd like to thank you both and all the men and women of DHS for having our back, standing guard in harm's way to protect the nation and our healthcare heroes. Thank you.
To report any internet-related crime to the FBI, visit www.ic3.gov. AHA members may direct questions on these and other cybersecurity risks to John Riggi, Senior Advisor for Cybersecurity and Risk, at jriggi@aha.org.